What does resolved mean?
So when we resolve a case of COVID-19 from a public health vantage point, it typically means that you've had 14 days from the time of your positive test that we've monitored you, or the time that you develop symptoms. And we have counted off 14 days, and after that time period, you're no longer a risk of spreading it to others in the community. That's the average. If you've had a severe case of this and had to be in the intensive care unit, we may give you other recommendations. But for the general public, it's 14 days. And the science of this is that we know now that you shed virus before you develop symptoms, as you develop symptoms, and then for around 5 to 7 days afterwards. So 5 plus 2 or 3 is around 8. That's on the average patient. There are extremes beyond this where you're shedding virus at day 10, 11, or 12. And to be the most cautious, Canada has chosen 14 days from the time of your positive test or the symptom development to ensure that you're no longer infectious to others. We don't now recommend that you get retested whatsoever because the test only checks for viral particles, and some individuals can shed viral particles for weeks or months afterwards in a very small number of individuals. And so we have to follow the basic science for the vast majority of individuals that within 14 days of the test being positive or your symptoms developing, you're no longer deemed infectious to others, and we will call that case in our counting to be resolved.